Okay, so we are going to expand a little bit on the PSA test, the Prostate Specific Antigen. Remember we spoke earlier, it is that blood test that we use to screen for prostate cancer. Now, it's important that you get this PSA test, this blood test, done every year. The reason is you want to watch for something called PSA Velocity. What PSA Velocity is the change of this PSA number over the course of time. Essentially, we don't want it to change. We want this PSA value to stay relatively the same throughout the years. If it does start to change, that's called a velocity, the change in it. For example, year 1, you'll say your PSA is 1. Year 2, your PSA is 2. So that means your PSA has changed from 1 to 2. It's gone up 1 point. Your PSA is not supposed to change more than 0.75 in a year span. If this is happening, it sets off little yellow flags. When those yellow flags go off, it just means you would probably want to watch that prostate and that prostate number a little bit more carefully. But again, you just continue to get it tested every year. The top end of the scale is 4. When your PSA is over 4, then it sets off another yellow flag and you're supposed to do additional testing. At this time, I always tell physicians and patients they should look into another test called a percentage of free PSA. So it's an additional blood test. You can do it along with your PSA test, and it's relevant whenever your PSA is over 4. So if your total PSA is over 4, you're going to run what's called a PSA velocity, a percentage of free PSA, and you want that percentage of free PSA value to be high, right? So of course you're going to want to talk to your doctor to help you kind of figure out these values. You don't have to figure it on your own, but just so that you're aware of it. If the PSA comes back elevated, you want to do an additional test called a percentage of free PSA. That's going to give you more data. In situations like this, it's all about data. The more data you have, the more information you have, the better. Which kind of brings up my second point of the prostate exam, that physical prostate exam that so many guys dread. I know it's not something that guys want to do. It's something they want to try to avoid. But you got to keep in mind, at least please get the PSA blood test, right? It's a little piece of data that'll give you a little peek into your prostate health. And if anything is wrong with that, then after that, you and your doctor can consider doing the physical exam. It's really not that bad, and it's definitely worth it, right? So you want to really look into this. If you guys have any other questions about your prostate or prostate health or the PSA testing, please check out our website, check out our blog, give our office a call. If you have any questions, we'd be happy to answer any of your questions. All right? Thanks a lot. We'll talk to you soon.